Hi there, you're welcome to RX Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you're able to get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, you'll be able to help support our community here at RX Care. All right, so let's talk about our topic of choice today. So our topic of choice today, or medication of choice today, is Carvedilol. So Carvedilol is also known as Coreg, and this medication is used to treat hypertension or heart failure as well as atrial arrhythmia. And this is usually known as an abnormal heart rhythm in patients. So Carvedilol comes in 3.125 milligram. It also comes in 6.25 milligram, 12.5 milligram, and 25 milligram tablet. So usually patients would take the 3.125 initially milligram twice a day with food, and the maximum could go up to about 50 milligram tablet twice a day. So depending on what they're treating, usually the maximum is about 50 milligram twice a day. So what are some of the side effects that you want to look out for when you're taking Carvedilol? So the side effects include low blood pressure. It can also cause headache in some of our patients. It can cause a slow heart rate. Like I said, it's used for increased heart rate in some patients. So this is a common side effect, which is to slow down the heart rate of these patients. Also, it can cause high blood sugar. A common side effect of Carvedilol in terms of diabetes is it can mask the low blood sugar symptoms. So patients who are taking this medication, if they do have diabetes, then you want to make sure that you're checking your blood sugar periodically or regularly in order to be able to tell anytime you have a low blood sugar so you can treat it, because this medication, as I said, can mask that symptom. Also, this medication can cause an abnormal weight gain in patients. It can cause diarrhea. It can cause dizziness. It can also cause erectile dysfunction through reduced libido in some patients. It can cause back pain, vision disorder, or tiredness. So what are some serious side effects that you want to make sure that you're reaching out to your doctor for immediately when you start seeing these after you start taking the medication? So serious side effects will include asthma episodes, increase in asthma episode, especially in patients who have a history of asthma. If you start seeing an increased episode when you start this medication, then that is a very great condition or concern to bring up to your doctor when next you go for your appointment, or even as immediately as possible. That way they can help taper this medication and see if there are other options that you can substitute the medication for. Also, some other severe symptoms of this medication is severe low blood pressure. So this medication can cause a severe low blood pressure, most especially in our elderly patients. So you want to make sure that you're checking your blood pressure regularly. That way, if you start noticing, a severe low blood pressure trend in your blood pressure values, then you can bring that up to your doctor. Also, some patients may notice chest pain as well as swelling, or abnormal heart rate in patients. Some patients may notice like a consistent fluid retention in their leg area, or leg pain when you walk, or leg and feet pain, that when you start feeling like a cold or numbness in your leg or feet that's consistent, you want to make sure that you're bringing that up to your doctor. Also, some patients might feel lightheadedness, dizziness, or fainting. These are concerns that you want to start bringing up to your doctor immediately when you start feeling those symptoms, as well as a rapid weight gain or swelling in your hands and feet. These are, like I said, serious side effects that you want to make sure that you're reaching out to your doctor immediately when you start seeing these side effects after taking the medication. So for patients who are taking this medication, you want to make sure you're taking it with food and milk, or milk. It is better absorbed when taken with food or milk. So these are, administration procedures that you want to employ when you're taking this medication. Also, you don't want to stop this medication all of a sudden. It can cause that increased heart rate that, patients are, taking it for prior to, just stopping it all of a sudden. This medication is a medication that's slowly tapered when patients want to be taken off of the medication. So the doctor will usually slowly decrease the medication dose until they get to the last dose before they stop that medication completely. So in order to kind of avoid that withdrawal side effect for patients. Also, as I said earlier, this medication can cause dizziness or headaches. So you don't want to take anything or you don't want to perform any activity right after taking this medication that requires you to be mentally alert, unless you've been taking this medication for a period of time and you know for sure that this is not a side effect that you have when you take the medication. As I said earlier, this medication can mask the symptoms of low blood sugar. So for our patients who have diabetes, you want to make sure that you're checking your blood sugar regularly or as advised by your physician. That way, if you have any low blood sugar, you're able to treat it immediately before it worsens and you start actually feeling the severe side effect of low blood sugar. For patients who are taking the extended release capsule, you don't want to chew or crush the tablet. However, you can empty the contents inside a spoonful of applesauce and make sure that you're swallowing that immediately. That way, you're able to get the full dose of the medication. And like I said, this is the extended release capsule is not a medication that you want to chew or crush. All right, I hope I was able to help in terms of what to look out for while taking this medication. And if you haven't yet done so, make sure you hit the like and subscribe button down below in order to help support our community here at Demi RX Care. Thank you and stay tuned.